I'm going to get us started. I'm Dr. Davis. You guys will meet Dr. Marvin here in a second. This is Heather McDonough. Jolene Zabuskas is in the back. She's our nurse practitioner in women's health. And then Sophia Lyon, wave to your hand, Saf. She's our nurse practitioner in family medicine. So Saf and I do a lot of tag teaming. But we're the 4 providers here at Prairie Health and Wellness. How many of you, this is your first time in our clinic? A few people. Okay, great. So a little bit about us. We're an integrative, functionally minded clinic. So we like to attack problems from a dietary standpoint in most cases, which is really what we're going to be talking about tonight. And it doesn't mean that we don't know how to use medication. We do still remember that. We just like to find ways to treat things naturally if we can. We are a direct care clinic, so we don't contract with insurance companies because we'd rather contract directly with you. And that means that we're able to provide our care at a significantly reduced rate and spend more time with people rather than following an insurance model and doing what insurance companies want to do. So those are some things that kind of make our clinic a little bit unique. And those of you who've been here before kind of know how that works. We're going to be talking about Autoimmune Paleo, or AIP, as you probably heard it, if you have heard it. And it's going to be a dietary approach to treating autoimmune disease. So I'm going to turn it over to Dr. Marvin. She's our naturopathic doctor here. Both Dr. Marvin and I went through 4 years of medical school. And in my medical school, I learned primarily how to treat things with surgery and pills. And in her medical school, she learns how to treat things naturally. So I'm trying to learn how to be more natural in our approach here. So we're very blessed to have someone like Kristen in our practice. We'll have some time for question and answer later. We are filming this, so if you ask questions during the presentation, just know those will be on YouTube. I don't have a way of editing those out. And if you have a really embarrassing question you want to ask, wait until later. I'll turn the cameras off and say, all clear. Just know that if you stand up and ask a question while we're filming, that's implied consent that I get to put you on the YouTube to the world. So, all right. Get started.
Well, thank you. Thank you for such a nice introduction. And as always, it's so exciting to see so many faces here whenever we do our educational talks in the office. One of the things that inspires me the most is when I work with people who are inspired to take such good care of themselves. So it's always good to see your faces. And so for tonight's lecture, some things that we're going to focus on, I wanted to give you guys kind of a rundown of a list of objectives to cover, but I'm just going to keep it really simple and give you a brief overview of the immune system because we are talking about an approach that treats autoimmunity. I think it's important that we just have a very basic concept of why we're recommending what we recommend. So we'll talk about what autoimmunity is and then some of the causes of autoimmune disease. And then like Dr. Davis mentioned, we're really going to talk about how we can heal with food. And then Heather McDonough, who has so kindly joined us, is also an expert in this autoimmune area and food, always. And so she's going to help me towards the end because one of the purposes of why we wanted to lecture on this topic is because we want to give you guys some really good tips and ideas on how you can implement this because any type of change can be really difficult and tough. Especially if you don't have the tools and resources. And so please feel free to ask questions, like Dr. Davis said, either throughout or you can wait until the very end. And then we're going to share some awesome treats for you guys so you can see that even with this type of dietary approach, you can still eat food that tastes really good. And hopefully you'll find too when we talk about some of these things, I know for myself, researching and learning more about this dietary approach, I found that it's really just, it makes a lot of sense. We're eating real food. So hopefully we'll give some more insight into how you guys can do those things without feeling so restricted, as oftentimes a lot of diets do make us feel that way. So with that being said, we'll jump right in. We'll talk about some of the immune system basics. We know that the immune system is really our body's defense against infectious organisms or other types of invaders that might be in our environment. And through a series of steps, what we just simply call the immune response, we know that our immune system really can attack those organisms or even foreign substances that can get inside the body and even potentially cause disease. So another way we like to look at this or talk about this is that your immune system really does a good job of recognizing yourself, so your own cells, your own tissues, versus things that would be non-self, so things outside of your body that may be a threat. So you can see we also have barriers that can protect us against these foreign invaders. So obviously the skin being a large barrier, even our brain has something called a blood-brain barrier, and even the gut. And so tonight we're going to talk a lot about our gut or our intestine, and talk about how and why that plays such a big role in autoimmune disease. So especially when it comes to the gut, another thing that I want you guys to know about and think of when we start talking about just the process of autoimmunity is that in our intestines, they're actually surrounded by a network of blood and lymphatic tissue that carries cells that can protect us when something does breach that barrier. So I have a really cool picture coming up in a few slides where I'll show you guys kind of what that might look like and why the barrier of the intestine is such an important part in the autoimmune process. So what is autoimmunity? And knowing that our immune system is supposed to recognize our own cells versus cells that are not our own cells, we like to call it a betrayal of the immune system. So unfortunately, for a number of potential reasons that we'll start to explore and talk a little bit more about, our immune system starts recognizing our own tissue as a threat and starts inappropriately attacking it. So then we can end up with a number of different illnesses and disease. And so some of the common types of autoimmune disease that we'll see in our practice here are things like rheumatoid arthritis, where the immune system will actually start attacking the joints of the body. Hashimoto's or Graves' disease is another very common autoimmune condition where your immune system starts attacking your thyroid gland. And then many autoimmune processes can even happen in the location of the intestines or at the gut, like celiac disease, where people have an allergic response and then an inappropriate immune reaction to gluten. But even Crohn's, ulcerative colitis, and then many, many more. There's been over 100 different autoimmune diseases that have been recognized. So this is something that we see a little too often than what we'd want to. But hopefully this through this process that we'll talk about with the AIP approach, we'll start to see a little less of that. So there's 3 different main categories that we can contribute autoimmunity to. So one of them being genetic susceptibility. So it's very common for us to see different types of autoimmune diseases run in families. And oftentimes it won't necessarily even be the same type of autoimmune disease itself. So I may be working with a mom who has Hashimoto's or an autoimmune disease against her thyroid gland, and her son may have type 1 diabetes. So we can see different types of autoimmune disease run in families, but the genetic susceptibility is usually there. The other part with autoimmunity is that there tends to be some type of trigger in the environment. So that can present itself in the form of an infection, like a bacteria or a virus. We even have some data that suggests a very common virus, like mono, can be a trigger for autoimmune diseases. But there's other environmental triggers too. So chemicals, heavy metals, things in your environment that obviously are very foreign to your body that can set the stage and be an environmental trigger. And then I put bad luck on there. Sometimes we just don't know why this happens. We aren't always able to identify an environmental trigger. It doesn't mean that we don't try, but unfortunately, sometimes we do just have to chalk it up to bad luck when we can't find the exact answer for the trigger. And then, which I'm sure the next one, many of you would probably nod your head and say, yeah, that makes sense. Our diet and lifestyle plays a huge role in being a potential trigger for autoimmunity. So we're going to talk a lot about those things tonight too. But in terms of when I spoke a little bit earlier about how important the gut is in all of this, I always tell patients that I work with, the gut is such an important place for many different reasons, but the majority of our immune system actually resides in our intestines. And if we think about it, with the gut being one of those main barriers, that's a really good place for a big part of our immune system to be. So you can see this is actually the picture I was talking about earlier, where we have the lining of the intestine here with these little cells that we call enterocytes, and the gut is a mucous membrane, so it actually produces mucus, and it's supposed to be there to help for protection. But you can see if there's any type of assault on the barrier of the gut, then we can have things that start to come through, and then of course we're going to talk a little bit about leaky gut or intestinal permeability. But then we have all these little immune cells down here that again are really there to protect us from that outside world, because really inside the gut is technically still outside of the body, okay? So I want you guys to think about that too. But this quote from one of the doctors who we really have enjoyed, I think Dr. Davis and I got to hear him lecture once at one of our continuing education conferences, and he's a medical doctor who does a lot of research with the gastrointestinal system and the microbiome. But in one of his recent documents, he stated that in addition to genetic predisposition, which we mentioned, and then exposures to triggering non-self antigens, which would be the things in your environment, like possibly an infection or an environmental toxin, like a chemical or heavy metal, and then the loss of the protective function of that mucosal barrier, which you'll see is mainly the gastrointestinal system, but even in the lung, he mentions, that's really necessary for autoimmunity to develop. So that's why when we look at something like the autoimmune paleo approach, it plays such a huge role in terms of what can be going on in the gut. So leaky gut, who's all heard of leaky gut? And who's been told that leaky gut isn't real? Yeah, Dr. Davis. So, I think this is really the picture I get in my mind when somebody says leaky gut. We think of like these huge holes that take place, but we also like to use the term intestinal permeability. So it is a permeable layer of tissue, because obviously we need to be absorbing things like vitamins and minerals and healthy fats and proteins to support other areas of our body, even the immune system. The immune system needs those things. So with intestinal permeability, we know that this can occur when, remember on the previous picture, the group of cells that line the gut, either individually or as a group, can be damaged or compromised. And then we can get permeability through what should be this very tightly regulated barrier. And so when this happens, we can actually see very small microscopic holes that are formed, not necessarily like this goofy picture here, but the contents that are in the gut, so things like bacteria or even bacterial fragments, food proteins, can actually leak through those microscopic holes. And where do they go? Right into the arms of the immune system, those immune cells that were waiting there. And typically that's a good thing. Again, it's there for our protection. But when we have kind of that triad of a genetic susceptibility, a trigger, and then we've maybe got some intestinal issues, can kind of like set the perfect storm for the potential for autoimmunity to develop. So, it's really important that we look at these areas that can contribute to intestinal permeability. Obviously, very much so can be rooted in diet and lifestyle, especially stress. Certain medications can even cause issues with the intestinal membrane, and then types of infections. So kind of going back again to some of those triggers. So we'll look at some of those too, but really we want tonight's main focus to be more so on the dietary piece of this. So anybody include these things in their normal dietary intake? Dr. David? I'm kidding. Okay, so what are the things that we should know about the nutritional piece? So we know that dietary factors obviously can contribute to nutrient deficiencies, and like we just mentioned, we know we want that healthy gut membrane to absorb the vitamins, minerals, and nutrients to not only support tissues that are in need, but also the immune system. We know that some of these factors can contribute to leaky gut or that intestinal permeability, and then even can affect our microbiome. So our microbiome is our collection of bacteria and yeast that make up a large part of our intestine. And then other factors that can contribute to inflammation or immune activation. So let's start with nutrient-poor diets. Again, we know that these nutrients that we're talking about absorbing can influence the immune system, okay? And on average, many of us Americans especially are deficient in a lot of vitamins and minerals like B vitamins and things like iron and calcium and vitamin D especially. So it's always good. We like to ask questions around here. We always like to ask why. So it's good that we ask that question here. And so one big theory that I think a lot of us would largely agree with is that many Americans consume foods that we consider to be nutritional lightweights. So things like grains and dairy, and then even with industrial farming and factory farmed animals, when we are displacing good healthy foods like vegetables and fruits and high quality meats and fish in our diet with foods like grains and dairy, then we're really lacking a lot of these micronutrients that we need because these foods here, the grains and dairy, just don't stand up to the other more nutritionally dense foods. And so that we know that with a lack of these more nutritionally dense foods, especially in conjunction with these types of foods like grains and dairies, or grains and dairy, that this has actually strongly been linked to the development and progression of autoimmune disease. So foods that contribute to intestinal inflammation and dysbiosis, because remember, those things then in turn can influence our intestinal permeability, which is a huge component to developing autoimmune disease, are going to be these foods listed here. And when you look at an autoimmune paleo approach, these are going to be on your no list. And so I think it's more important to understand why they're on the no list rather than, well, they're just on the no list and we're not supposed to eat them, right? So all of these types of foods that are listed here, so grains, gluten, which is the protein found in wheat, but grains like corn, millet, rice, spelt, even different wheat varieties, gluten's found in things like barley, obviously wheat and rye, and then even pseudo grains like chia and quinoa. So these types of foods all contain substances that either increase intestinal permeability or contribute to the intestinal dysbiosis, so an imbalance of bacteria and yeast in the gut. Okay, and just remember that I think that piece alone, just important to remember, just with the health of the gut, the permeability of the gut, that's the reason why some of these foods are on the no list. Caffeine, I always kind of jump to that one because everyone's like, oh, coffee. And you know, it's a big deal because coffee is something many of us enjoy. And sometimes it's part of like a morning ritual. And so, you know, when we're taking things out of the diet and you feel very restricted, it can be very difficult because then you can also have this sense of loss too. And so, you know, there's a lot of studies on coffee that have been beneficial or that support health in some way, shape, or form. But when we're looking at someone who has an autoimmune condition and we're looking at inflammation and we're looking at things that can promote stress on the body, unfortunately, caffeine tends to fall in that category, even though some of the results of some studies are not exactly conclusive. But, you know, some people will say, well, you know, I really like coffee, but it gives me heartburn. And then when we're talking about stress, there's a little bit of data that even suggests that caffeine can raise cortisol levels, which cortisol is a stress hormone that definitely can contribute to intestinal permeability. Tea kind of falls in a similar category. We'll probably tend to find most often that most people do okay with teas. But when we're in the initial stages of having someone try this dietary approach, we find that it's better to initially remove those things because oftentimes we'll find that we don't know we're negatively reacting to something until we actually take it out of our diet. So we will often recommend that, you know, avoiding coffee certainly, but even tea initially may be helpful while you're trying to determine what foods are really exacerbating your system. But we'll talk a little bit more about some of the food part too when Heather gives us some more information. But I also think just quickly it's important to look at lifestyle factors that can contribute to autoimmune disease. So it's really important to identify any areas of stress and learn how to manage your stress well. Even inadequate sleep contributes to stress, and it also puts a huge strain on the function of the immune system. So lack of physical activity, even over-exercising, can cause issues with the immune system, and certainly with that stress hormone, the cortisol levels. And then medication use, things that are NSAIDs like ibuprofen. There's plenty of data that shows that that is very disruptive to the lining of the gut. Even steroids, which I'll come back to briefly, but PPIs are proton pump inhibitors, and so they block your stomach's ability to make acid, which your stomach needs acid. It needs to be acidic. It's part of the optimal digestion process. So that can then further lead to issues with the dysbiosis of bacteria and yeast. Even OCPs, which stand for oral contraceptive pills, so birth control, hormones have been shown, an imbalance of hormones have been shown to cause some issues with the immune system. So we always want to try to weigh the risks versus the benefits with some of those medications. And then obviously antibiotics. I think all of us are familiar that regular or even intermittent antibiotic use can contribute to that unfavorable intestinal microbiome. But with steroids, we have to be careful because oftentimes, sometimes people come in and they are on steroids to help suppress the immune system, especially if someone's having a major flare of whatever their autoimmune condition might be. So sometimes they can be very appropriate in certain circumstances. But oftentimes, we really try hard to, like Dr. Davis mentioned, to approach health, not always using medication if we can, because unfortunately what can happen with steroid use is that when you come off of them, your body becomes even more cortisol, that stress hormone, receptor sensitive, and the immune system can kind of come rearing back, with a vengeance. So we really try hard to modify all these other areas that we're talking about instead of reaching for medications if we can. But I certainly want everyone to understand that sometimes those medications are certainly appropriate and necessary too. So I love this quote, this Hippocrates quote. Everyone has a doctor in him or her. We just have to help it in its work. The natural healing force within each one of us is the greatest force in getting well. So when we supply our body with the appropriate raw materials, that's really when we can set the stage for optimal healing to take place. So how do we do this? And that's why Heather's here to help. Like we mentioned before, she is very experienced in this area, and I hope that she shares her story with you guys and how she became an expert in this field. But I know one of the things that I will often share with patients is what this picture says here. And instead of trying to replace our favorite foods, let's try to be creative and branch out within the allowed foods, or really what we should call the healing foods, the good foods, for an autoimmune approach. So I'm going to turn it over to Heather so she can talk about, and you'll find, hopefully you all picked up a packet. That's Heather's packet, and she has some awesome recipes in there, and we're going to talk to you guys and make sure you have lots of good resources too. So please.
Okay, well, one of the slides showed a few of the foods that can aggravate the immune system. But since we're all kind of starting from a different place, first I'm just going to kind of briefly talk about the paleo diet, the short version. How many of you are familiar with the paleo approach? Okay. Well, it really is about it's sort of an ancestral perspective on eating. And when we think of how human beings evolved many years ago, the caveman days, we really only had access to wild meat and wild vegetation, plants, fruits and vegetables that we found in the wild. There was no agriculture, there was no processed food. So the human body evolved eating meat and vegetables pretty much. And then obviously as agriculture came into the picture, hundreds and thousands of years later, the standard American diet is very, very different. But there has been a ton of research on the paleo diet being really the ideal diet for most people. Now, we are all very different, very unique beings, and not everyone thrives on the same diet that other people thrive on. But overall, a diet that is free of processed food, it's full of real food, whole food, is usually the most healing diet for for people. So the paleo diet is similar to the autoimmune paleo or autoimmune protocol diet. As you see in your chart in your packet, a paleo approach focuses on fish, meat, all vegetables and fruits, nuts, seeds, eggs, and of course some healthy fats. We are going to, with the autoimmune paleo diet, we are going to remove the nuts and the seeds, legumes, and the eggs. And that's what can make it a little bit tricky. It is very doable, and if you really focus on what you can have and not what you can't have, it makes it a lot more fun. And it really can be kind of a fun adventure. And the most important thing to remember about this diet is this diet is designed to help you heal your gut, and it is temporary. It's an experiment, and it's a fun experiment. You're going to remove these items from your diet, and then after a while, and some people need longer than others. I would suggest at least 3 months. At least 3 months. And then slowly add these foods in one at a time, very carefully. And I'm talking about, and it does give you a sort of a rundown in your packet, but the first one might be egg yolks or egg whites, and you have that for breakfast 3 days in a row, let's say, and you see how your body reacts. And when that food has been removed from your diet for a significant period of time, you can really learn to listen to your body. And this is a great experiment in learning to listen to your body. Our bodies are constantly giving us messages, and we don't always tune in and listen. So this is a really good exercise in that respect. So the next one might be black pepper. That's a really tough one because we are so used to in this society of putting salt and pepper on everything. And pepper is good, and it gives a little kick, but you will be able to live without it. So that might be the second thing you add in, and you really just put pepper on everything for 3 days in a row, and listen to your body and see how you react. And if you're fine with egg whites, if you're fine with pepper, that may not be a trigger for your body. So you just have to add these things in slowly, one at a time, so you can really tell. Let's see. There are a lot of things that are good substitutes. Since we're not doing nuts, coconut is really kind of your creamy source. Coconut milk can make soups creamy and wonderful. We have a soup recipe here tonight that you'll be able to sample with some coconut milk in it. Avocado is a wonderful creamy source. There are definitely plenty of things. We brought a few samples of some flours. You're going to try a cookie that's made with cassava flour, and this is made from do you say yucca or yucca?
Tomato. We can say both.
Cassava flour. I got this on Amazon.com, and it is really a one-to-one substitute for white flour in recipes. And I realize, we're going for real whole foods most of the time, but there are plenty of recipes if you need a delicious treat that you can use this for. There are all kinds of flours out there that are AIP compliant. This is a butternut squash flour. It's literally butternut squash dehydrated and pulverized into a powder, and it acts like flour. This is similar.
Where did you find it?
These I also got on Amazon. Yeah, this is apple flour. They also have sweet potato flour. Plantain flour is a wonderful, wonderful source for baking. This is tiger nut flour. Tiger nuts are they're little tubers. They're tiny. They look like nuts, and they kind of have a little crunchy texture. They're sort of sweet, but they're actually a tuber. A potato is also a tuber if you need an example of a tuber. This is an incredibly good source of resistant starch. Resistant starch is food for the good bacteria in your gut. It makes delicious treats. This is green banana flour. You can do all kinds of things with this too. This is another great form of resistant starch. I got this at Sprouts. You can find this at Sprouts. You can find the tiger nut flour at Sprouts as well. Some of these things you have to get online for. see.
I just want to mention too, when Heather's talking about a resistant starch, she's talking about a nutrient that really feeds your own beneficial good gut bacteria. So when I'm talking earlier about, wanting to create a healthy, balanced microbiome, feeding it with obviously, real vegetables in their whole form, but even some of these things that contain what she's calling resistant starch is a good option too. And so sometimes if you're not cooking or baking, because like Heather mentioned, we want to try to transition a little away from that. But it's nice to have still good, healthy options while you're doing that. We like to have that as an option. Sometimes I'll even put those things like into a smoothie if I'm trying to increase my intake of some of the fiber
I do
type
that.
things.
I put a couple tablespoons of this green banana flour into my smoothies, and it doesn't taste like anything. It doesn't taste like bananas. You can get on their website and find all kinds of recipes, and we're going to show you some really good resources. I don't know how many of you are familiar with Pinterest, but I'm going to make sure that you're familiar with Pinterest before you leave if you're not. Before we move on, carob powder. Chocolate is not on the AIP diet, and that may be something that you miss, but maybe we can bring it back in and maybe you'll be fine with it. This is carob powder. You can use it in a 1-to-1 ratio with cocoa powder. There are lots of recipes out there for treats made with carob instead of cocoa powder. You need to be really careful with the spices that you use to season your food, and that can be another sort of challenge with this AIP diet. Black pepper is a berry-based spice, so is juniper. The seed-based spices you want to avoid as well, and that would be cumin. What's another one? Caraway. Cardamom. Yeah. So anything that is a leaf, like thyme, rosemary, anything that is a little green herb is fine. This is one of my favorite seasonings, whether I'm doing an AIP approach or not. This is called Herbamare, and you can find this at any health food store with the spices. And let me just read to you the ingredients. Some of these I might not say correctly. Sea salt, and I need my glasses. Sea salt, celery, leek, cress, I assume that means watercress, onion, chives, parsley, lavage.
I've not heard of that one.
It is a plant.
Yeah.
Garlic, basil, marjoram, rosemary, thyme, and kelp.
Very good.
It's actually lower in sodium than salt too, and it just really gives. It's in the soup. I don't know. I didn't want to oversalt the soup, so. You can come up with soup. Okay, thank you. This is a great thing to have in your spice cabinet. Smoothies are a really good breakfast option on the AIP diet. You can use coconut milk as your base, which makes it really creamy and delicious. And adding collagen is a really, really good source of protein and a wonderful healing nutrient for your gut. Bone broth is really big. I don't know how much buzz you've heard about bone broth, but bone broth is when you take bones from animals, preferably very healthy, pasture-raised animals, and you cook it in some water and some vegetables and a little bit of apple cider vinegar, which draws the minerals out of the bones. And when you cook it for quite a while, 24 to 72 hours, the collagen and gelatin in the bones of the animal are leached out into the liquid. And collagen is the connective tissue that holds our body together. And it's incredibly nurturing to the lining of the gut. So when you're doing this kind of a dietary approach, the more collagen and gelatin that we can get through bone broth or other sources like these, the better. I mean, this is what we want to heal the gut during this process. You can get these are individual collagen sticks that are great when you travel. When I travel, I take, if it's possible, I take a blender with me. And, there's usually a little mini kitchenette kind of thing, even if it's not a sink. It might be a mini fridge in a bar. And I'll bring some coconut milk, some collagen, a banana, some nut butter if I'm not doing the AIP approach, or some fresh fruit, and I'll make a shake, and that will be a breakfast or a lunch while I'm traveling. So these travel sticks are great. You can also get a container like this. They sell the collagen here. This is by the same company. This is gelatin. It's powdered gelatin, and the little Jello kind of looking thing that you have was made with the gelatin and fresh berries and coconut milk, and a little bit of liquid stevia and a banana. And that is very Jello-ish. You can use less gelatin and make it not quite as thick, but that's also a good breakfast idea. The gelatin can be used as an egg substitute, and I'll have you pull that up in a bit here, because I don't know of a better substance to use as an egg substitute if you need an egg for baking. Let's see. Let's talk about some resources. For those of you that are already doing a paleo dietary approach and you would like to try this to see if you can reduce some inflammation or maybe reverse some of your autoimmune symptoms, you're close with the paleo approach, but you just take a few more things off the list, and it really is easy. I have psoriatic arthritis. It's very similar to rheumatoid arthritis. It's related to psoriasis. Usually people get the psoriasis, the skin symptoms first, and then the arthritis symptoms come later. I was actually opposite, a very low percentage of people have the opposite. I had incredibly awful pain in my toes and my heels. It was mostly in my feet. Some people get pain in their fingers, in their hands. Some people get it in their hips. It's not fun, but I really didn't want to go with the conventional medical approach of taking really strong drugs. I wanted to have another baby, and I could not be on the drugs and try to get pregnant at the same time, and so I really just dug my heels in and tried to figure out why I was having this imbalance in my body and what I could do with my diet and lifestyle. And I removed gluten, I removed dairy, and kind of experimented a little bit with diet, and I have a full and active life. I mean, there were points at which I couldn't wear certain shoes. I was limping, and now I can run. I play tennis once a week. I do everything that I want to do, and pain-free. I'll have little flare-ups here and there, but I always know that they're temporary, and I really have been able to control this with diet and keeping stress low. And it can be a fun adventure. Like I said, there's so many resources now. Do you want to pull up Pinterest?
Yeah, can we go ahead and stop the filming, and then that way we can do some Q&A and show some resources too.